Good morning. My name is Patty Malagon. I am a research associate at PPIC. Welcome to our virtual program featuring findings from PPIC's report, Reducing College Costs for Low-Income Students. The report, technical appendix, and slides can be found on ppic.org. This research and today's briefing are supported with funding from the College Futures Foundation. We would like to thank them for their continued support. First, I will present findings from the report and then invite Paulette Shaw, my co-author and colleague, to join me for the Q&A discussion. If you have questions during the briefing, please email ppiceventquestions@gmail.com. As a reminder, PPIC is a public charity and does not take or support positions on any ballot measure or legislation, nor does it support, endorse, or oppose any political parties or candidates for public office. Now we can get started. This report is called Reducing College Costs for Low-Income Students. My co-authors are Paulette Shaw and Cesar Alessi Paris. I'd like to thank them for their work, our combined work on this report. And first off, Californians benefit from higher education, but college costs are barriers to college completion. According to a PPIC statewide survey, about 2/3 of California parents are worried about college affordability in the state. Low-income students make up a substantial share of the undergraduate population at public colleges and universities. 72% of students are low-income at community college, 50% at CSU, California State University, and 40% at the University of California. At the California State University and University of California, a significant share do not graduate within 6 years, and close to half of first-time degree and transfer seeking students at community colleges leave the system within 4 years. Students often cite financial obstacles as the main barrier for college completion. In our report, we look at the lowest income students, which I'll define at a later point. But these are students who typically qualify for the maximum need-based financial aid, and yet they still may face some constraints to cover the remaining financial burden. And in the report, we define financial burden as a gap between the financial aid package and the cost of attendance. And we show how 2 safety net programs can help fill this gap for students at the UC, CSU, and community colleges. We focus on CalFresh and Medi-Cal, since CalFresh helps cover food costs through cash-like benefits, and Medi-Cal allows UC students to waive the university health plan and receive cash refunds. And I'll explain a little bit of that in a moment. By leveraging federal safety net dollars, the state can help make college more affordable for students, and the state could benefit from economic mobility, reduced poverty, and greater civic engagement. First, I'll focus on CalFresh, and then we'll turn to Medi-Cal. CalFresh is the state's implementation of the Supplemental Nutritional Assistance Program, and this program helps low-income individuals access food by providing monthly cash-like resources. There are about 5 million people participating in the program, and all individuals must meet the income eligibility rules, which depend on household size. But students, first they have to be defined as a student, and then they must fulfill one additional requirement. And a few examples include participating in work study, being a parent, or receiving a TANF-funded benefit, such as CalWorks or a Cal Grant, but not all Cal Grants are TANF-funded. Other factors considered when determining eligibility are the student's age, the meal plan, and housing arrangements. A student must be receiving 11 or fewer than half of their meals from the meal plan to be eligible for CalFresh. CalFresh student eligibility can get complicated really fast, and research from the California Policy Lab has found that eligible students often do not participate. CPL found that 26% of likely eligible community college students participated in 2019, and only 22% of likely eligible UC students. The authors couldn't assess or didn't have access to data for CSU students. according to a California Department of Social Services report. Pre-pandemic data showed that about 18.5 to 30% of all eligible students received CalFresh. So for this report, we obtained cost of attendance and financial aid package amounts for the 2024 through 2025 academic year for a student with a student need index of 0 or lower. And I'll go over that in a moment. But for students at each of California's public higher education systems, the UC, CSU, and community college, we again defined or calculated the student's financial burden, and this is a gap between the cost of attendance and the total value of the financial aid package. And when we were building our financial aid packages, we included federal student loans, federal Pell Grants, Cal Grants, and other types of aid for a typical student with a student aid index of 0 or lower. And then we showed the impact of CalFresh and Medi-Cal for students living on campus, off campus, or at home. We focus on young adults ages 18 to 26 who are enrolled full-time, and we define the lowest income students as those with a student aid index of 0 or lower. So the student aid index is an indicator of the student's ability to contribute to the cost of attendance. It is used to determine the financial need. So a lower number demonstrates a higher financial need and a higher likelihood of receiving the maximum amount of aid, or for example, the federal Pell Grant. The index considers household size, assets, and the student and family's income. We want to acknowledge that safety net program and eligibility does depend on factors beyond income. So we try to make realistic and hypothetical assumptions about each scenario that I'll go over in a moment. A few of these assumptions are that each student meets all the eligibility requirements for both programs, and that there are no eligibility gaps during the academic year. And for CalFresh, that they receive benefits as their own single person household. And our wonderful technical appendix, which is only 23 pages, offers more detail on this, but please feel free to ask questions during the Q&A. So when we look at the financial impact of CalFresh, we see that CalFresh reduces the UC students' burden by about half for a student living on campus, and adds about $300 in disposable cash for an off-campus UC student. At CSU, resources vary due to a lower cost of attendance, although the CSU estimates a higher cost for students living off campus. We see that CalFresh reduces the on-campus students' burden by about half, and a CSU student living off campus could see a 25% reduction from $8,900 to about $6,700. Our community college scenario shows a student living with parents. This student living with parents receives, again, CalFresh as their own single person household. And in order to do so, we assume that the student is 22 and older in accordance with CalFresh policy. These scenarios also factor in aid only available at community colleges and do not include federal student loans, since only less than 2% of students received them during a previous academic year. CalFresh, again, reduces the burden for a student living off campus by 24%, and a student living with parents could have close to $5,000 in disposable cash, and this could allow the student to borrow less or work less during the academic year. When we turn to Medi-Cal, we focus only on UC students, since the system, since it's the only system that requires students to purchase health insurance, unless they can show proof of other coverage at the beginning of the academic year, including Medi-Cal. So Medi-Cal is a public health insurance program for low-income and disabled Californians. There are about 14.4 million participants as of fall last year. So a UC student can waive the university plan called UC SHIP and have their insurance fee of $3,639 refunded by showing proof. So this is the annual cost of the university plan. And while Medi-Cal and CalFresh can have an overlap in income eligibility rules. They do not have specific requirements for students. When we look at the impact of Medi-Cal, we see that a UC student living on campus could have their burden decreased by 90% from $4,000 to $396. And an off-campus UC student could see their burden replaced with $1,800 in disposable cash. Undocumented students are ineligible for CalFresh and federal financial aid, but they can enroll in Medi-Cal due to the state's recent expansions to eligible undocumented immigrants, and they can receive state financial aid. So this analysis would apply for an undocumented student at a UC. If each of our UC students were to enroll in both programs, they could see again their burden replaced by disposable cash to cover other needs. The state has taken several efforts to support college students. There are a few on the screen here, but these include expanding Medi-Cal to undocumented young adults, funding basic needs centers at community colleges. In 2017-2018, the California Student Aid Commission and campuses began sending notices of potential CalFresh eligibility with their financial offers. And these are a few, but it's still important for policymakers and stakeholders to continue this discussion around college affordability and connecting students to safety net resources. So in our report, we list a few of, I'm sure, many recommendations that the state and stakeholders can continue to do around their efforts to improve college affordability and safety net access among students. So a few are that colleges and universities can improve coordination between their financial aid offices and basic needs centers. This could make more students aware of their potential for or potential eligibility for safety net resources. UC campuses could send health information with around the university plan, refund, and waiver with their financial aid offers, so students can be better prepared at the academic year. Campuses can connect with typically basic needs centers don't focus on health insurance, but campuses can connect with Medi-Cal navigators, Medi-Cal ambassadors to inform students of healthcare coverage or insurance plans, get them connected to a plan and help retain that plan. There's also efforts on leveraging data to identify and connect likely eligible students to resources. And leaders around the CalFresh related higher education statewide data agreement are working on a status report that the state legislation will be looking at soon. I just want to close off with, or this part of the findings, with our earlier remarks that higher education can be a long-term investment in an individual's future as well as the state's economic future. The state could benefit from economic mobility, reduced poverty, and greater civic engagement. And if you have a question now, you can submit them to ppiceventquestions@gmail.com. Or if you have a question or want to talk about the report or our work at a later point, you can email Paulette Shaw and or you can email me at malagon@ppic.org and shaw@ppic.org. Now I would like to welcome Paulette, my colleague and co-author, to join me for the Q&A discussion so we can answer some audience questions.
Hi, Patty. Thanks for inviting me.
Hi, Paulette. Thank you for joining me today. Let's see if we have some audience questions. Okay. We have a question from Chris in Oakland. Are there other programs like CalFresh and Medi-Cal that can further reduce college costs, and are they effective? And please feel free to jump in when you want, Paulette. But yes, there are other programs. And in this report, we focused on CalFresh and Medi-Cal since these are, as we've seen, cash-like resources and also have the largest poverty mitigating impact on Californians. but eligible students, students with dependents can access TANF, WIC, and other benefits like tax credits. There are also work study programs that we weren't able to include on our financial aid package side of the equation. But are there other ones that could benefit students, Paulette?
Yeah, I think you covered it, Patty. I do think that we really focused on CalFresh and Medi-Cal because in the context of students, these are the programs that basically translate into cash for UC students getting SHIP waiver refunds and cash-like resources in the case of CalFresh. In general, most safety net programs are not cash-based, but of course, there are other ones that are, and I would say in terms of effective, if you mean like, do they actually provide cash to students who need money to fulfill their financial burden? I would say yes, and they usually also have additional aims such as, of course, CalFresh is nutritional assistance, Medi-Cal is public health insurance. We actually have a fact sheet about cash-based safety net programs that you can take a look at, including programs such as the Cal EITC, which is similarly cash.
Yeah, and yeah, that's a good plug. I think also basic need centers are a great resource and can help offer like personalized support for students and connect them to the right resources that might be more effective or like lead to better outcomes for each individual student. Okay, I think our next question is from Jennifer in Sacramento. Does experiencing financial burden in college have long-term impacts? If so, can you tell us more about those impacts? I think I maybe a little bit alluded to this in the presentation, but financial burden can have a long-term impact on students, like student-led loan debt and prolonging college completion. A student may need to borrow more money or work more to fill in this like gap that we're calling the financial burden. And students could see like a reduced course load or working part-time to cover this. Yeah, do you want to add anything else, Paula, for Jennifer?
No, I mean, I would just say that the long-term impacts aren't just for the individual, but they're also for the state, because the state really does stand to benefit from having a more educated and engaged workforce and populace. So it is kind of bigger than just the individuals that we're talking about.
Yeah, that's good. And we have another question from Mario in San Diego. How can we improve college affordability in the state? You want to take this one, Paula?
Oh, yeah. So just for context, Patty and I are safety net researchers, but we do have an entire higher ed center. And actually one of our colleagues, Rachel, recently put out a fact sheet specifically around college affordability that we'd love to point you to. And I think that that's a much bigger question that our colleagues on this higher ed side of the house can probably do a better job of answering than the two of us.
Yeah. And I do want to like mention one quick thing around this. The state also implemented the California Kids Investment and Development Savings Program like 3 years ago. So the state like funds a college savings account on behalf of babies born after July 2022 and allocates money to eligible low-income public school students and fostering homeless youth. And this, program could make college or career training more affordable to a younger generation. So the state is, or making some leeway in here. But yes, our higher education colleagues can answer that question probably better. We have our next question is from Sarah in Folsom. You discussed Medi-Cal's budget effects for UC students, but what about students in community colleges or campuses at the California State Universities? Yeah, that's a good question. And Paulette, feel free to jump in. But while these two systems don't have a health insurance requirement, the program does provide a financial safety net for participants. Previous PPIC research on the Health Inclusive California Poverty Measure found that poverty would increase from 16.8 to 24.2% among young adults ages 19 to 25 without this program. would you like to add anything else, Paulette?
No, I think that health inclusive poverty measure is a great point that, that really does focus on kind of the cost of having health insurance and the resources provided by getting insurance such as Medi-Cal. But I would just add that for all people who have health insurance compared to being uninsured, it's not just about the value of that product, but also kind of managing the risk around having things like catastrophic healthcare costs that can be really that important safety net for low income students. The reason why we focused on the UC is because we were really doing an accounting exercise with kind of financial burden and how different safety net programs could kind of fill that with cash or cash-like resources. And of course, there is no cash-like resource for community college and CSU students because there's no refund, because there's no health insurance requirement. So that's why we focused on UC, but that's not at all to say that Medi-Cal isn't important for all low-income students, and that it really does provide a financial safety net and a protection against catastrophic expenses.
I think maybe this will be our last question from Jenny in Daly City, but Jenny is asking, is there a way to automate enrollment in CalFresh and Medi-Cal using financial aid data? And feel free to add anything, Paula, but I think I mentioned the California Related Higher Education Statewide Data Agreement. So this is a combined effort with the Department of Social Services, the California Student Aid Commission, and the 3 public higher education systems in the state. So these stakeholders, leaders are working on a status report of their efforts around this. And it, according to an LAO document there, the status report was due in February. So we'll be tracking that development. In 2022, the U.S. Department of Education also released some guidelines for colleges to use federal financial data to inform students of federal public health insurance and food assistance. So yeah, these are some efforts that are happening in this area that could benefit us and the state. Did I miss anything, Paula?
I guess I would just caution, this is always the bad news with safety net programs. It is really complicated to go through the enrollment process for a lot of these programs. And as Patty mentioned, CalFresh does actually have a specific student requirement that is very technical, and you have to be kind of knowledgeable to be certain that you qualify. And so even when we are able to identify low-income students, we can't say with certainty that they can just enroll in these programs. And so I think that you had discussed earlier that there are some colleges sending out letters of likely eligibility to low-income students, saying you probably would qualify to enroll in, let's say, CalFresh. And I think that's a really good way to go because it kind of highlights the availability of the program, the likely eligibility, but it's really hard to auto-enroll people because the data that are in the financial aid form are not the data that are, that they aren't sufficient for determining eligibility for programs like CalFresh and Medi-Cal, just because those programs have their own eligibility requirements, many of which are kind of complicated. So that's kind of the bad news, but there is good news, which is that I think getting it on students' kind of mind that this is available and that they should look into it, and that there are supports available on campus, like through basic needs centers, or through, campus liaisons with the county. I think that that's a really good start, but I don't know if auto enrollment is coming anytime soon.
Yeah, that's thank you for keeping that
Sorry to be negative.
I think we were able to squeeze one more question from Amy at the Foundation of California Community Colleges here in Sacramento. Amy is asking, it doesn't appear there has been a coordinated effort regarding student housing, though this is under the umbrella of basic needs. What are some specific efforts that could assist students in California beyond those headed by specific institutions? I feel free to jump in, Paula, but I think my response might be a little limited. We focused on this report on CalFresh and Medi-Cal since we've mentioned it, that they kind of serve as cash-like resources. So we didn't focus on student housing, which is definitely under the umbrella of basic needs. through kind of like our research and learning more about this, there are various resources across campuses, and educational opportunity programs or basic needs centers can connect students with housing subsidies, grants that the university or other organizations might offer. Do you want to add more to that?
Yeah, it's so we kind of struggled with this, to be honest, because our report is not really about basic needs. It's really about kind of the financial gap between what it costs to go to college and what financial aid is available for the lowest income students based on their student aid index. And of course, housing is part of that, and it's really salient in a place like California, where housing is so expensive for everyone, but certainly for students who are low income and don't have an ability to contribute financially to their own cost of attendance. And so I would say that just to plug the things that we did focus on, both CalFresh and the Medi-Cal, fee refund at the UC are fungible resources. And so this is either cash in hand or near to cash in hand. And so it is money that can contribute to helping to pay for rent, because if you have, N dollars that you can spend on, food, that's N dollars that kind of gets freed up in the rest of your budget. And so there is the hope that by kind of supporting students with cash and cash-like resources, that they can navigate the difficulties of housing in California, which is a really much bigger topic than we tried to take on. But absolutely, housing is probably one of the most salient basic needs for low-income Californians in college, as well as in other situations.
Yeah. And yeah, I also think that the kind of scenarios that we showed, colleges provide like a cost of attendance, but students can also budget for this differently. And our accounting analysis are, limited in that aspect as well. So that could definitely, free them up or free their budget for something else like housing.
And it's probably, yeah, totally. And it's probably very regional as well, with some places like coastal California is just a lot more expensive than inland parts of the state. And so it's not completely monolithic, but you're right. We did work from the student budgets that were available for the different living situations at the three systems.
Exactly. I think that might have been the last question, Paulette. Thank you so much for joining me and helping answer our audience questions.
Thanks, Patty.
Thank you. Okay, I think we came to the end of our event. I'd like to thank Paulette and Cesar Alessi Perez as well for co-authoring this report. We've reached the end of the event. I also would like to thank the College Futures Foundation for their support and thank our audience members for joining us today. We would appreciate you taking a moment to give us your feedback on this event. If you pre-registered, I think you'll receive an email with a link to a short survey, or if you want to get it out of the way, you can scan the QR code on your screen now. And a recording of the event will be available soon on the PPIC website along with the slides, and you can access the report and technical appendix. The video will also be posted on PPIC's YouTube channel, so you can watch it again or share it with your network. Thank you so much and have a great day.